Hi, my name is Danielle from Southern New Hampshire University. I'm doing this project for my BSN, for one of my BSN courses, Nursing 325. I'm here to be doing a full assessment exam on my volunteer patient who agreed to participate and be video recorded for the school. For the first step of this is to show a 360 view of the room. So we're gonna do that and then we'll get started. So here is the room. .360 view. All right. So we're gonna pretend that we are in a clinical setting, and in this case my patient would be dressed in a gown so that I could be able to assess her skin and different parts of the body, and I would be closing the door for privacy. And now we're gonna start by verifying her orientation questions, her name, and some of the psychiatric memory test. So, can you tell me your full name and date of birth?
My name is M.H. My birthday is April 30th, 1965.
Okay. And can you tell me the date, month, and year?
Today is February 14, 2022.
Okay. And can you tell me what you did on your last birthday?
I had work and night I have a dinner with my family.
Okay. Now, Maria, she's from Brazil, so her English is not fluent. So in this case, we would have a translator to be able to assess her fully and make sure that she understood everything. Because we are not doing that here, I will not have her do this test, but I'm going to explain how it would be done. So I would be assessing her psychiatric and memory test by having her count backwards from 100 by 7, and then I would also give her 4 words to memorize and then have her count back from 20 and then ask her to repeat the words to see if she was able to remember them. And Maria, can you tell us where we are right now?
We are in New Hampshire in the clinic.
Okay. So now I already cleaned my hands, so I'm gonna start by inspecting her hair. So I would be looking for symmetry, see if there's any bald spots, see if they are evenly distributed. I might even ask her to remove her hair tie and do that. And then I will be checking your temporal artery and checking for pulse. And then I would be also checking your eyes, make sure they are even, your eyelids, the color of your eyes, the nose, the mouth, the ears. And then I would be palpating your sinuses. So you let me know if there's any pain.
Mm-hmm.
So her hair looks good. The sinus feels normal. There's no pain, no tenderness. Her ears look good. Nose, mouth, eyes, everything looks symmetrical. Her face looks symmetrical. I'm also gonna perform a test here for her skin. So you tell me if this is dull or sharp, okay?
Yeah, tall. Sharp.
Okay.
Sharp.
Okay.
Dull.
Okay.
Dull. Tall.
Okay.
Sharp.
Okay. And then I'm gonna be checking for her lymph nodes. So we would be starting over here on her neck, behind her ears, over here, down to her chin. I'm gonna check. And I'm gonna check here on her neck. and I don't see or feel any lumps. Do you have any pain?
No.
Okay, there's no lumps. I'm gonna check her clavicles. There's no lumps. Everything is nice and soft, nothing too big. I'm gonna check for her armpit, which it also looks good. And then here, it also looks good. I'm gonna check her thyroid. I'm gonna be going behind her neck and palpating everything here. And can you swallow for me, please? Okay, and swallow again. And it looks nice and even. There's no pain.
No.
And then can I have you look at me, and I'm gonna have you smile. So right now I'm looking for all the cranial nerves. Can you lift up your eyebrows? Okay, now frown your face and puff up your chin. Okay. And let's see. I'm going to go look inside your nose, and your nares look good. I'm gonna have you look at me and open your mouth. Okay, and put your tongue out. Okay, and to the side, and the other side, and up and down. And her mucosa looks nice and pink and moist. There's no thrush or anything inside her mouth. Her gums look healthy. Inside her nares, it looks nice and pink. I'm gonna look in your ears. And in her ears, the tympanic area looks pearly gray. And the same thing on the side. And I forgot to check one more thing. Can you say ah?
Ah.
Okay. And then I'm gonna have you close your mouth. I'm gonna check for TMJ, and I'm gonna palpate. Open your mouth, close. Okay. And front your teeth. Don't let me open. Can you bring your jaw side to side and forward, backwards? Okay. Now I'm gonna have you cover one nose and blow and then breathe. Okay, and do the other thing. All right, now I'm gonna be doing a smell test. So cover one nose, one there, and then close your eyes and tell me if you can smell that.
Mm-hmm.
What is it?
This is I don't know the name, but smell good.
Lemon.
Oh yeah.
Okay, put the other one. And
this is mental.
okay, so that's good. Then I'm also gonna do a whisper test. So I'm gonna have you plug this ear. And I'm gonna whisper and you repeat the two words, okay?
Cats and dog.
Okay, now let's do it with the other side.
Cow and pig.
Okay. And the other thing we would be doing, so her senses here that I tested, she can smell, her ears, she can hear. We're gonna do the tongue. This is my improvised tongue depressor. So we would check for gag reflex. I would have her open her mouth and stick that on the back of her throat. And if she gagged, she would have a gag reflex intact. We're not gonna do that now. But then the other thing is I'm gonna point that at your nose to just check for your corneal reflexes, and it's good. Now I'm gonna check for the pupil. They're nice, equal, round, and reactive in your eyes, and they are. And now we are gonna do this test. We're gonna test her peripheral vision, so if you can cover one eye. And whenever you see the pen, you say now, but look at me, don't look at the pen. So
All right.
here we go.
Now.
Okay.
Now. now,
Okay.
now, now.
Okay, let's do it with the other one, and we're gonna do the same thing.
Now, 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 now,
Okay.
now.
Now, can you just look at this? Just focus on the pen. Just look at it. Okay. All right. So your pupils are nice, round, and reactive. Now we would do a Sneller test, which we don't have here, but is a vision test. We would have her stand 20 feet away from a chart. We would have her reading line 20. If she's able to read that, her vision would be 20/20. And that would be she would cover one eye, read that, and then cover the other eye and read that too. Okay. And now I'm going to perform we're gonna, also, as I'm doing all of this throughout my examination, I would be looking at her skin and making sure that her color is nice, her skin is not too dry, she's not diaphoretic, there's no moles, nothing that I'm worried about. I would be looking at her legs as well. As I'm assessing each part of her body, I would be looking at that as well. I will be looking at her fingers, on her joints on the fingers, looking at her nails, they look nice and pink. I will be checking her capillary refill, and it's less than 3 seconds, so that's good. I will be doing the same thing on her feet, looking at her little toes and checking for capillary refill and the color as well. So I don't see anything, everything seems to be normal. So now we're gonna jump to the respiratory assessment. So this is my improvised pulse oximetry. So I would be checking her pulse and it's all nice and normal. She is 97% of room air. And now I'm gonna come over here. I'll check her back for symmetry. Take a deep breath, and it looks nice and symmetric. And then I would be also palpating to make sure there's no lumps or anything. I would be looking at her skin. As I'm palpating, I'm also gonna do the CVA testing to check for inflammation of her kidneys. So I would go down her back and putting my hand over and then bump a little and let me know if there's any pain.
No.
And
No.
pain. Okay, now I'm gonna check for Frementis. Can you say 99?
99.
Okay.
99.
Okay.
99.
Okay.
99.
All right. Now I'm gonna be listening to her lung sounds on the back. Take a nice deep breath. Let me know if you get tired or lightheaded. Okay. And I'll be listening here on all 5 lobes. Okay, and it's all nice and clear. Then I'm gonna be coming to her front. I'm also gonna check for symmetry. Take a deep breath. Okay, and I'm gonna be palpating and percussion. I'm gonna do the percussion on the back. And everything sounds normal. Okay. Now I'm gonna have you say 99.
99. 99. 99.
Okay. Now I'm gonna check your breath sound. Nice deep breath. Okay. 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 And on the side. Okay, and on the side. I'll say 99.
99. 99. 99. 99. 99.
Okay.
99.
Say 99. gonna be doing her cardiovascular system. So, and to do this, we're gonna, actually, I'm gonna have you lay down. I think it'll be easier to do that. That way I can do all of the assessment at the same time. All right. Okay, so we're gonna pretend that this is not on the way, and I'm gonna be, checking symmetry. I'm also going to be checking for her pulses. I already checked the temporal, so I'm gonna check for the carotid pulse. And if you look this way, I'm gonna be checking the carotid pulse and looking for the jugular vein to see if there's any distension. Everything looks good. I'm gonna check a little better here with the light and come over this way. And looks good. Everything looks good. And then I'm going to, with the bell of the stethoscope, I'm gonna be listening to the pulses on her temporal. And then her carotid. Okay, look that way. I'm also gonna listen to the aorta, see if there's any bruit. Check for bruit. And the kidney arteries. And her femoral. And then I'm going to be checking her brachial pulse. And her AC. Her brachial, and then the wrist, which I just did. Then I'm gonna do her femoral. And her popliteal on each side, and then check for her pedal pulses and the posterior tibial, and it all is nice, normal, 2+ feeling. And then I'm gonna listen to her heart sounds. Okay? You doing okay?
Mm-hmm.
And then I would be turning to the bell, and I'm gonna listen for abnormal sounds. And her heart sounds normal and regular. So now I'm gonna be looking again as she's laying down. I would be lifting the gown, looking at her skin to see if there's any hives, any rashes, any moles, anything abnormal. I would be looking at the skin all over this part of the body, and I will be checking for symmetry of her abdomen. Everything looks good. So now I'm gonna listen, and I'm gonna start on the right lower quadrant. I'm gonna listen 1 to 2 minutes. And then we're gonna move to the right upper quadrant, and then to the left upper quadrant, and to the lower left quadrant. And now I'm gonna percuss. And it all sounds good. And I'm gonna be palpating. Any pain anywhere?
No.
This is just a light palpation, checking for any masses, any lumps or anything, and everything. Her abdomen is soft and tender. She has active bowel sounds in all 4 quadrants. In a normal exam, we would be doing a deep palpation, which we are not going to do now, but we would also be looking for enlarged liver, enlarged spleen, and enlarged kidneys. So for her liver, I would be asking her to take a deep breath and then pushing it down here to feel for the liver. One other way to find out too is do a percuss from the top down and to stop where the sounds changes, and then make a line and do the same thing from her like umbilical line up until the sound changes, and then make a line, and that would be her liver. For her spleen, is really large to feel unless it's enlarged, but we would start on this side over here on her right side, kind of midline, and then going sideways up to here with a deep palpation to see if we could feel the spleen. For her kidneys, we would be pushing down on the back side here, her flank, and we would be pushing from the top as well to feel for the liver. So everything looks good. And then since I have her down, I will be also checking for sensations. So this is sharp and this is dull. So can you tell me what this is?
Sharp.
And this.
Dull.
And this.
Sharp.
And this.
Dull.
And I would be doing this throughout her body. Right now she has clothes on, so she might not be able to feel it, but if she had a gown, she would be feeling that. So her sensation is normal. So I'm gonna have you now sit up and right here. Ow, I got a shock. Thank you. And actually this might be better, I'm sorry, this might be better to do when she's laying down. So I'm gonna have you lay down to just check. It'll be easier that way, the camera can see, and it'll be easier for you. So if you could please lift your leg up and down, and the other one up and down, and do your knees, bring your knees up and in and then out, put it back. Same thing with this one, and in and out and put it back. And then I'm gonna have you adduct, so that way and back, and the same thing here, and abduct, and now over one leg and back, and over the other and back. And I'm gonna check, so bring your toes towards your head and then push down. Okay, and now move it around. I'm gonna hold your legs in circles. Okay, now open your toes, crunch your toes. All right, push against my, okay, and now the other way. Don't let me put it down, good. Bring your leg out, don't let me, yeah. Bring your leg in, okay. Now bring it out, don't let me push, okay. Do the same thing. Right here we're checking her musculoskeletal system and strength. And one thing that I'm gonna do before you get up is that I'm gonna listen to your heart on your left side. So if you can turn to your left, and I would be listening to her heart sounds. Okay. And I would be also looking at her joints, so her knees, her ankle. I would be looking at her elbow and shoulders and all the other joints. And now you can sit up, don't fall asleep. Okay, all right. So now I'm gonna have you put you're still doing the musculoskeletal, so put your arms out and then this way and then close and put it down and up over your head and behind your head, put it up, down, back, behind you. Okay, move your elbows this way and back and this way and back. Okay, now this way again and don't let me push. Okay, now don't let me, yeah, good job. Now bring it this way, don't let me bring it down. Okay, don't let me bring it down. All right, stretch your hands again and open your fingers, put them apart, and then crunch them, move your wrists. Okay, up and down, make a fist, up and down, and move it, so everything is good. And when she was moving her arms, we were checking for her shoulders joint too, as well. So it all looks good. And one other thing for her motor is I'm gonna have you, with your heel, I want you to move up and down your leg. Okay, and move up and down your other leg. All right, and now I'm gonna have you put, touch your finger to my hand and to your nose. So let me get out of the view of the camera. So, okay, into your nose and back and forth. Okay, keep doing it.
Yeah.
Keep doing it. Faster, 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 faster. Happy do. Faster, faster, faster. Okay. All right, that looks good. Now we're gonna check for her reflexes, her deep tendon reflexes. I don't have a reflex hammer, so I improvised this. And I'm gonna have you loosen that. And then we will be checking over here as well. Relax. Okay, and then I will be checking her patella as well. And we would relax. Okay, we will check here as well. And we would check her Achilles. So for that, I would be bringing her toes up and then doing the reflex on the back of her ankle. And then here, and her reflex are all present and intact. I'm gonna have you stand up. And we're gonna do a, I forgot the name, gastroparesis or something test. So we're gonna have you close your eyes, put your hands out, and can you tell me what object that is?
Battery.
Okay, and then tell me what object this is.
Okay.
Okay, now I'm gonna draw something, so keep your eyes closed. I'm gonna be drawing a letter in your hand. You tell me what it is.
Oh.
Okay, and here.
A B.
Okay, so that's all intact. And then I'm gonna have you close your eyes. I'm gonna do the rumbar test and check for balance. See if she can keep her balance with her eyes closed. That's very good. Okay, now I'm gonna have you walk normal that way. Walk back fast. All right, and walk back heels to toes. Okay, close together, okay?
Mm-hmm.
And then I'm gonna have you walk back on your tippy toes. Okay, and then walk back on your heels. Very good. I'm gonna have you come back here. We're gonna do one more stretch. So go forward, try to touch the ground. I'm gonna be looking at her spine, see if everything is even. Okay, come back. And now I'm gonna have you go turn this way on one side and one side, and down. All right, and rotate. Okay, and then your neck. So down and up and back and this way and this way and circular motion. Okay, now don't let me, I'm gonna check your strength here, so I'm gonna push this way and you try to come this way. All right, and then this way. Okay, and down. All right, and up, back. Okay, very good. And we are all done with the head to toe assessment. Thank you very much for
You're
participating.
very welcome.
Thank you.